Okay, and say, welcome to Returning to Running. I am Ashley from Birthsmarter, and this is one of our community conversation series, and I'm really not going to say anything for a long time. Mostly I'm just excited that you're all here. I schedule these events because I'm really a curious person and just want to learn things and like doing that in community. So we have these events every week, and you can find them at birthsmarter.com/community conversations. And that's it, really. Alicia, you should take it away. I'm like very eager to learn something today. No
I'm
pressure.
very excited to talk about it. Hi, everyone. My name is Alicia, and I am a women's health physical therapist, also a sports physical therapist. So I actually recently started my own business in New York City, focusing on prenatal postpartum women's health and athletics and running and everything like that. So this is definitely something I'm really excited about. I know I want to save a decent amount of time for questions at the end, so I'm going to be as concise and as simplistic as I can be, but like I said, I really like talking about this, so I'm excited to get going. Big thing that I kind of want to start out by saying is, in context of what we're talking about, like there is a ton of variability. Runners are really different. How people run are different. Endurance is very different from speed. And then, obviously every pregnancy and delivery process and postpartum recovery is very different, and it's highly variable. And in how I treat that, I also treat it highly variably, because we kind of need to be treating the person, not just, having this one protocol. So I want you to keep that in the back of your mind, that these are very general guidelines, but there always can be variation within that. So kind of how I want to organize the talk and how I kind of figured it would be most helpful would be to talk about running in of itself, and talk about what goes into running and what's required of the human body with, sans pregnancy and postpartum. And then I'll go into talking about running during pregnancy. I know that there's a few pregnant people with us. We'll talk about how to return to running postpartum, and then also what are some of the potential things that could happen if you maybe return in too early. So I'm gonna kind of, as long as you guys can hear me, I'm a big mover, and if you want to move around, feel free to move around. I'm a kinesthetic learner, so I like to kind of feel things. But running in general, what differentiates it from just plain walking is that flight phase. So there's a point in running in which you leave the ground and then come back down. So just by virtue of that increases gravity's effect on the body. And that's a big thing that we're going to be talking about, because say there's something off in either your running form, or maybe like biomechanically, maybe your muscles are kind of funky. Having increased load will affect that to a greater degree. So running is a little bit more complicated than, say, walking or any other maybe just slower activity, because you have to respond quickly and your body has to adapt to gravity. Depending on the research study you read, like, people can say the load on one leg can be anywhere from 2 to 4 times your body weight. I've read up to 8 times your body weight. So it kind of depends on what you're reading. But bottom line is that running has an increased load effect on your system. So to kind of give you a really simple kind of biomechanics lesson in running, a big thing that I focus on is to remember that while we are traveling forward, running is not just that sagittal plane, that traveling forward activity. There is a lot of both rotation and side-to-side motion that has to happen at all joints in the body with every step. So you can kind of think of running as like hopping from foot to foot, if you think of it pretty simplistically. But when we do that, a big thing to remember is that you're not just going forward. There has to be, and this is where I'm going to kind of move around a little bit, make sure you guys can see me in my makeshift office. So as we take a step, can everybody see me? Ashley, I can see you, so thumbs up, good. As we take a step, it's not just this. There has to be a little bit of a side to side and a little bit of rotation, and that's where you kind of get that arm swing. Your trunk has to rotate. All of this kind of has to coil up, and then as you propel yourself forward, you uncoil, enter flight phase, and then the same thing happens on the other side. So it's constantly a load, explode, a load, explode, and that's really important to remember, because muscles are controlling that gravity and that ground reaction force that we're getting in running. So we want to make sure that all of the muscles that we need to control that rotation, to control that load, are with us and that they're working properly. So that's a pretty basic way to think about it, just kind of knowing your head that it's not just traveling forward. There has to be a little bit of side to side. There has to be a little bit of rotation. And that's important to think of because your muscles just don't run up and down. So your glutes, they run transversely, and your obliques, those run on diagonals. And it's important to remember that we want to get all of those muscles really active in any state, pregnancy, postpartum, or none. All of those really active to have a good running form. So a little bit of vocabulary in terms of running that I tend to look at to kind of make the conversation a little bit easier down the line are cadence. So cadence is just steps per minute. It's something that I look at all of the time because it kind of tells you it really shouldn't vary based on speed too much. So even if you're running a little bit slower or you're running faster, that steps per minute, that time that you take on the ground should be pretty consistent. So, you kind of aim for anywhere between 175 and 180. Again, a little bit of variation within that, but cadence is a big thing that I look at. It's important for what's coming forward, which is also ground contact time. And this is going to become important as we talk about pregnancy and postpartum as well, is how much time are you spending on the ground? So that kind of plays a role in, you kind of have the spectrum of runners. You have those people that are really, really bouncy and they're like, they look like they're just floating. And then you have the people that are like loosey-goosey and they're spending a lot of time. So you want to kind of know where, going into it, where your kind of baseline is of where you're standing. But that's going to be, again, ground contact time is going to be something that I look at in all my runners. So it's good vocabulary to have in that sense. Other things that I'm going to talk about are that forward lean, which we know we really want to have, and then I want to look at that cyclical motion in the legs. So I'll do a little demo of that again going forward, is you want to make sure that the legs are propelling you forward and you're not just falling, and that happens a lot. Again, once we'll talk about this, will make more sense when we talk about pregnancy and postpartum, but you want to make sure that the leg is coming up behind you, knees pulling through, and that there's this motion, that like cyclical motion happening with the leg to make sure that those muscles are doing their job. So overall, we're looking at, in general running, we're looking at how are we attenuating load? Are our muscles working in all of those planes? And from a gait parameter perspective, like how does our run form look as to, or is the cadence too slow? Is our contact time too slow? So kind of keeping that as a separate thing, talking about just general pregnancy and what it does to the musculoskeletal system. Obviously, the baby grows in the abdomen, so that right there will change your center of mass and change your center of gravity right off the bat. So, and we know, because that's where the baby's growing, your abdomen and your ab wall is getting over lengthened. So muscles don't love working in over lengthened positions or positions that they have this length tension relationship where they like working in a certain spot, and when they get too long, they don't love working so well. So obviously the abs are taking a hit during pregnancy. Another thing that tends to take a hit is, we think of that overall, that pregnancy posture of the belly pulling you forward. That can start to pull the pelvis in a little bit more of a forward position, and maybe the hamstrings don't want to work so well, maybe the glutes don't want to work so well, and all of those muscles kind of have to compensate for the fact that your posture is very different from where it was before. So muscularly, there's a big change that happens during pregnancy that we want to be mindful of when it comes to any exercise, and especially when it comes to running. With that, when you're like, think about normal gait. So when you think about as pregnancy progresses, normal walking, what's that first thing that starts to happen is, the base of support tends to widen out, your feet start to space out a little bit, maybe the toes start to point out, arm swing starts to get lost because the belly is in the way. So those are similar things that you want to keep an eye on if someone is running during pregnancy, is what is that basic just gait form looking like, and how can we correct for it? So when it comes to running, if we think about the big question is it going to do damage to my pelvic floor? People always ask me that. And it really depends on, you know, your proportions, what your pelvic floor has been exposed to in the past, what your previous level activity was, and how you're running. Like I said, you have very different types of runners out there. And if you're the type of person that tends to put a lot of pressure going down, maybe there's a lot of, it's like a heavier run, that could be putting more pressure on the pelvic floor. Pregnancy in general puts a lot of pressure on the pelvic floor. If you think about that canister, your pelvic floor has to sustain way more pressure than it's used to on a day-to-day. And you want to be mindful of how you're increasing that and what we're doing when we do increase that as in something with running. So if we're talking about running during actual pregnancy, I'm okay with it. I have people do it through pregnancy as long as, you know, everyone is listening to their body. And I think, like I said, there's the spectrum of both runners and there's a spectrum of bodies. Like some people run really tight and really stiff and maybe their system can sustain a little bit more impact. Some people run a little bit more loosey-goosey and maybe they'll feel the effects of running on the body a little bit more. A lot of the times with runners, you know, you're kind of programmed to push away some of those feelings of discomfort, especially with endurance athletes, but it's really important in this time to listen to your body and make sure that it can, you know, sustain that pressure and make sure nothing is feeling like too pressuresome or too painful. So what I tell my pregnant runners is we want to stay strong and we want to make sure that our run form is really solid. So if we think about that same kind of mechanic that happens during walking, a similar, again, not completely the same, a similar mechanic can happen when we're running. So essentially, you're going to get pulled forward a little bit, so it can almost feel like you're falling. You're going to lose that trunk rotation a little bit. Maybe your base of support widens. And that's going to have an effect on how responsive your glutes are and your abs are and all these muscles that we know are really, really important in sustaining stability during running. So a lot of the times this happens where, you know, I have my avid runners and they continue to only run during pregnancy. And that's where you can start to run into a little bit of an issue because your body is changing and there needs to be something that we're doing to make sure that our muscles are keeping us really stable and keeping us really, really healthy. So strength is a key component of, it's almost like, you know, you're training for a marathon and everybody says how important strength training is to remain injury-free. I always think of this, pregnancy is a marathon. So you kind of have to have the same mindset in it and staying really strong to be able to sustain that. So with that, the strength piece of it is important. And then being really mindful of the form and what we talked about before when it comes to just straight up running mechanics. So I always tell people, especially if they're feeling kind of uncomfortable, interval work is the best way to, if you want to continue to run, interval work is the best way that you're going to be able to do that. And it's not just, you know, you think interval work, you think like speed work. It's not that at all. It's more like an interval of making sure you're picking your knees up, you're swinging your arms, you're keeping your cadence, your steps really, really frequent, and you're keeping that really solid form for a short condensed period of time. And then you're walking and letting that recover. So in that sense, you're not only allowing your muscular, like that muscular system to maintain that control for a shorter period of time, you're allowing your brain to kind of comprehend like, okay, this is what we have to do right now, and then I'm going to be able to take a break. Because, you know, in any form, when I have to retrain a run gait for anyone, you always kind of do it via interval because it's way too much to think about for a longer period of time. So interval work is a really, really good way if you want to continue to run during pregnancy, to be making sure that you're staying on top of your form and making sure everything feels really, really solid. That being said, as you do get further into pregnancy, it's really, you have to be mindful that like your body is just less stable and you're heavier and things are not as stable as they were before. So making sure you're still taking into account how much, not only are you running, are you walking a ton? Overall load, especially as we near the end of pregnancy, is really, really important so that you're not creating like a compensatory tightening of the pelvic floor, which can sometimes happen towards the end. Like if you're doing too much, things can really tighten up. And if you're planning on having a vaginal delivery, you know that that's kind of the opposite of what we want as we get closer to delivery, which is to let things start to relax and start to go. So Going into now a little bit of postpartum talk, I will say from here, it is highly variable again. Like what you were able to do in pregnancy, whether that be running or not, but strength work, what your activity level was in pregnancy will impact what's happening postpartum. How you delivered will impact what's happening postpartum. So C-section, vaginal delivery, the grade of tearing vaginal delivery, all of those things will play a role in time required to get back into running. And like everybody, like I said, everybody kind of heals at a different rate when it comes to that. So, you know, this isn't necessarily a return to exercise talk, but you do have to be mindful that in that postpartum period, there has to be a period of healing, no matter what, that needs to happen so that your body can start to at least give itself the benefit of the doubt of we're semi-stable, you know, maybe if there was tearing, if there was a C-section, we're healing, and we're healing appropriately and giving enough time to do that. So that's kind of that, like, first couple weeks are just straight up healing, and that kind of goes across the board for anyone. Like I said, what you did in pregnancy will affect that. Like the more, I always think of pregnancy as like prehab for the delivery process, because you're really prepping the system to be able to recover pretty quickly on that other end. So as you get into that postpartum period, once you feel like you have healed, things that I kind of look for are the key muscle groups that could get damaged during that labor and delivery process. What are they doing? So we think abdomen, we think pelvic floor, and we think like overall all these muscles in the pelvis. So if there was a C-section, if there was tearing, we want to make sure that those muscles that potentially were damaged, you can contract them, you can relax them. You don't have to like think too hard about knowing that they're there and that they're there to support you. From there, we want to think of those other heavy hitters that we need for stability, especially when it comes to running. So our glutes, our obliques, our hamstrings, our inner thighs. You have to start with just a strengthening program to be able to know that those muscles are going to be ready and have the endurance to actually start to sustain you as you get back into running. So anything from, you know, a basic stuff in the beginning, from like bridges, hemi bridges. You can do, I'm not a huge clamshell fan, but like, you know, some lateral glute work, some squatting, some abdominal work. I love the abdominal work that has to do with single side stabilizing, like dead bugs or bird dogs, anything like that in the beginning that's just going to start to wake the system up can be really, really helpful for recovery and healing, but also to get you into running quicker. So as we get into what we need for more running specific activity wise, you have to make sure that we're stable in single leg. So like I said, running is a single leg activity. So once you know you're strong, you're like, I got this, I feel good, I feel healthy, start to challenge yourself in single leg. So something as simple as a single leg squat can tell you a lot about what's going on. So this is what, like, a thing that I have my patients do all the time, where, you know, you're practicing relative single leg, you're on a leg, maybe toe touch on the other side. How does it feel just to use one leg and practice the squatting? Maybe you add in some runner arms, maybe you add in a little bit of rotation so that you start to feel what it feels like to stabilize on one leg. Once you feel like, and you can add load to that. Like I said, everybody has a, you know, if you're in the postpartum period, you have a baby. So and they're usually not light. So you can play around with, you know, using maybe the baby as your load. Start off body weight is first, but practice single leg work. And then from there, you can really see if, like, does one side feel stronger or weaker than the other? Is there an instability that tends to happen when I go on one side? And if you feel that, take care of it now. Take care of it while you can work on that strength period. And then you're going to avoid potential overuse or potential injury down the line. So single leg strength work is definitely a big like thing that I focus on. Again, it's kind of like I have these little stages, and once you feel good, you can kind of move on to the next stage. They can get fudged a little bit, but for the purpose of it, you kind of like want to think of it as relative stages. So you have the single leg stuff. From there, if you want to feel like you really want to challenge yourself, but you're not necessarily ready to jump, adding speed is a really great way to kind of figure that. So again, I'm just going to show you guys some of the things that I tend to do. But if I'm looking at single leg, okay, I'm slow, I'm controlled, maybe I'm doing a little bit of a tap back, front to back. How does that look when I go really fast? Because running is reactive, and we want to make sure that those muscles are really stable in a reactive way. So start to add speed within that single leg work, and again, see what starts to happen. I've had some people be like, this feels really good. I've had some people, when they try to add speed, uh-oh, I feel like I'm going to leak a little bit. So then, you know, before you get into the actual run, like, okay, I have to work on this a little bit and make sure that I'm staying really, really stable. So once you feel good with that, then we can start to play around with jumping. And there's a lot of variability within this. I usually say, like, it depends on the person. Some people feel really good when it comes to kind of switching right to left. You know how some people, instead of jumping rope on 2 feet, they do a little like front to back tap? Just as starting to incorporate impact is going to be helpful to train not only your musculoskeletal system, but your pelvic floor and how it's going to accept load and get back into it. So you want to start to play around with light jumping. Again, like you can play around from right to left and do that for, you know, you can do that in place. I love jumping rope. I think it's a really great form of exercise, but that could be a really good telltale of how your body is accepting impact and load in a short, condensed period of time. So incorporating load that way. And if this is a big turning point of like where people are like, this doesn't feel great. Either I feel leakage, I feel pressure, pelvic floor wise, maybe the abdomen doesn't feel awesome. If that's the case, I'm going to show you guys my like favorite little impact trick, which is going into, and you're going to see my kind of floor here, going into the pike position and practicing some stuff there. So if this doesn't feel good, the pelvic floor is going against gravity this way. If we want to start to play around with training the system in how to accept impact, what we can do is go into this like, you know, pike position where your butt is actually in the air and practice jumping this way. You can practice doing high knees, you can practice butt kicks, any of the jumps that, you know, you might be having difficulty with in, you know, in upright. Try it in that pike position. When you're in that position, the pelvic floor isn't challenged as much, and you can still allow the systems to start to accept load a little bit more. So that's one of my favorite ways to start to go into everything if there is any pelvic pressure. If not, you can kind of go that whole route of, okay, jumping feels good. How can I get this into more of a run drill? So then you start to go into high knees and butt kicks and things that you know, and skipping, things that we know really play a role in proper run form. And then also too, when you're doing all of those drills, you're upright, you're adding impact, you're challenging that system, you're challenging your muscular system in a fast way, you're challenging your pelvic floor, you're getting all those muscles to really be responsive in the way that we want them to be when it comes to running. So once you get all of those steps, I know it seems like a lot, but it can go pretty quickly if again, it depends on what your previous level was, or you can take it as slow as you want, which can also be kind of nice to be like, I know I'm doing this for my body and taking it slow. Once you get to doing all of those drills and you feel okay with it, then there's your time to start to play with, again, intervals. I love intervals. I think like with intervals, they allow you to, again, think of the form and think of the impact that's going through your body. And I think that I would always resort to intervals at both, like I said, both in pregnancy and that postpartum period. And then obviously in the postpartum period, you can start to increase the time of running and then make sure, you know, you're doing it appropriately and allowing your system to go back into it. So like I said, I love talking about this. I could talk about it all day. I just want to make sure that I cover a little bit of the dangers that can happen if you return to running a little bit too quickly that I've just seen in my own personal experience. So it doesn't always present itself how you think it would. Like, I think some people are like, oh, I didn't pee, I'm okay. Obviously, you know, pelvic floor issues, urinary issues, fecal issues, I've had those. The incontinence and the prolapse, those are definite risks of that could happen if you return to running too early. And you'll usually tend to feel those pretty quickly. But other things that start to creep up along the way are musculoskeletal issues. I've had people come back in 1 year, 2 years postpartum and have complete plantar fascia tears or hamstring tears or anything. And when I take a look at their abdomen, I take a look at their pelvic floor, you know, they'll admit that they went back into running too early. But a big thing of that, and like we talk about diastasis, it's like, If something was overstretched and then you're going and you're putting all these crazy forces into it, it probably won't love it. So thinking of the abdominal wall, thinking of the pelvic floor, you want to make sure that those muscles are healed and they feel secure. And before you go putting all of this gravitational load and all this force through, all this torque, running is so torque heavy that you want to feel that control in order to not, risk not only those pelvic issues, maybe that diastasis, but more long-term issues down the road of like that tend to happen because of instability. So there's definitely, it might not be as clear cut, but obviously low back pain is a big one too. But, things can happen, maybe not right in the moment that you feel, especially if you're just like kind of like going for it. But farther down the road, especially if you're a competitive athlete, competitive runner, once you start to pick up those heavy miles and like really the intense training associated with speed and, hill work, that's when some of these injuries can really start to creep in if you don't take the proper steps to going into it postpartum. I know I really want to answer questions for everybody. So, Ashley?
I also have so many questions for you, but
Yes.
I try to not ask them all. So I'm just going to give you guys time if you have questions to write them in the chat. So here's the first one, and then I'll intersperse mine while people are thinking. Would it be beneficial to stick to strength training and intervals before jumping straight into running?
Yeah, 100%. That's like I said, they're like in my like relative little steps. There is nothing short of just like being strong and having that stability within the system. Again, like I didn't really go into this, but if those hormones, like, in the postpartum period, those hormones are still fluctuating through your body. If you're breastfeeding, there's like a huge hormonal flux, which can create instability within the skeletal system. There is no substitute for strength work. I think it's so important. And if you maintain that and then obviously do the interval work in the same time, I think it's a home run. It's really, really good.
Wait, can I clarify? Some more questions are coming in, but so here's what I have, right? There's this like assessment period where you hopefully are checking in with someone like you, right? Like a physical therapist who can check on how your body is doing. Then there's stability in single leg, and then there's adding speed and stability in single leg. And then there's jumping, and then once you are running, it's like starting slow and maybe short, and then you like work up to speed and miles and hills and things like that.
Yeah.
So what, you just mentioned breastfeeding, and that was one of my questions. Like, how much of a difference are you seeing between people who are going back to running when they're breastfeeding versus not breastfeeding or waiting? And how much is like hormonally does that affect things?
To be honest, it's really dependent because it depends on what your starting point is. Like I said, like there are people who run, like not run, but like systemically run really tight, like their connective tissues are a little tighter, they kind of perceive themselves as really stiff. That might not impact someone, like breastfeeding might not impact that person as much, which I have that case happening like right now. She returned, we worked during pregnancy, so she was prepared, but she had a C-section and she's back pretty quickly. She's still breastfeeding. But then you have the people who are a little bit more loose, like they know that you're like, I'm a little bit more lax. Like I'm an ex-dancer. I kind of like float around everywhere. So I have not personally been pregnant, but it depends on where you start of how the breastfeeding will impact your system. And I think a lot of that is just going to go on how you're feeling. Like if you feel a little less stable, if you feel a little not as strong, it might take a little bit longer. You might need a little bit more of that strength period of that load increasing period to really feel stable going into running.
Okay. Okay, so here's questions. For someone who had acute uterine inversion, are there precautions I should take beyond those that you've shared?
Pregnant or postpartum?
Here's the clarification. Acute uterine inversion with a surgical repair after.
There we go. Sorry. I mean, there's probably, I'd have to it'd be dependent on like the surgical report, because if the uterus doesn't feel as stable within its own like connective tissue hangings, I would say there might be a little bit more precaution as it comes to just impact in general. that would probably be a little bit more specific question for the surgeon, because that could be really, really variable. So it's, if everything, like if, yeah, I would say that could be variable just depending on how severe and like what if the connective tissue that supports the, like how damaged that was in that process. But I would probably say that there's going to be more precaution involved with that, just because that is an internal like surgery that you want to make sure is completely stable before you go adding impact.
Okay, here's a great one. I'm sorry for the person who's asking it, but if you're feeling pubis symphysis dysfunction or SPD, is it okay to do a light jog or just avoid it altogether?
Hang on, so, oh, do they need to consult PT before running? Was that the question? Oh no, that's a different one. Sorry, I skipped ahead. If you're feeling that during pregnancy, so if that was during pregnancy but not in the postpartum period, is that the question?
Yeah, and let me just say, hold on, especially for people watching the recording, I'm going to beat you to having a pelvis. That pubis symphysis dysfunction is where there's a separation. You have, okay, Alicia's going to do it. You're going to do it better than me.
Okay. So pubic symphysis dysfunction is having issues or pain, essentially. Mine is missing an actual pubic symphysis, so it's where this space actually is. So that I have found is actually pretty variable as well. So sometimes what I find in pregnancy with pubic symphysis dysfunction is because that the pelvis tends to come kind of in that like more forward position, there's a lot of pressure at that, like, so abs come in and attach here. This is the attachment of your like six-pack rectus muscle abs situation here. So sometimes any pain within in this region gets just like thrown into a classification of SPD when you're pregnant. Like it's not super specific. So sometimes SPD can get mistaken for rectus strains, which I've seen in the past. A lot of the other times, something that can happen is if there's not adequate rotation and loading at the ball and socket joint in the hip, no matter what, your body will find a way to allow motion to happen. It's just how it works. And if there's increased pressure on the pelvis from pregnancy, sometimes a lack of control and mobility at the ball and socket joint of the femur can add increased pressure at this pubic symphysis joint. That being said, if you're having it during pregnancy, there's probably some force closure issue going on. So I would say, like, in going into that postpartum period, if you know you had this, but maybe you don't anymore, make sure, like, that's where I would say really, really check in with the single leg stability. Make sure that this joint, your hip joint, and like the surrounding, you know, your thoracic spine and everything is moving really well so that this does not have increased pressure. Does that answer the question?
I think yes, but I just want to clarify. So what about in pregnancy? If you're feeling SPD in pregnancy, like you're feeling that pain, avoid running or do a little bit of running?
To be honest, I would say if you could if you could actually see a PT, you could probably run with, like, I've had people run in pregnancy, but I wouldn't say that would be a good treatment for it. Like, I don't think I rarely say run into pain. Like, you don't want to have pain and then continue to run. Gravity is not going to be your friend in that case. So I wouldn't label it as like a way to kind of get rid of it. But if your goal is to run and you have SPD, you know, there are things that you can do to make that more appropriate.
Yeah, I think that answers it. We can see if the person that asked that wants to clarify. Okay, we're going down. If someone is diagnosed and pregnant, double question. All right, Lisa, that answered your question too? Yeah, okay. Cool. Any strength training programs or platforms you recommend for postpartum women? Oh, I can answer this too. What do you like?
I love personal referrals. So I like giving out my like personal people that I know in the area. Obviously Fit for Birth is a good one. There's like, what are your favorite fitness like strength training programs?
So Chelsea Method just came
I do
out.
love Chelsea, yeah.
Chelsea Method is newer, and it's two PTs from New York who started it. And there's two reasons I really like it. I think it's different than other programs. One is because it starts right away. Like you can start doing it at week 1 after you have a baby. You don't have to wait till that 6-week mark. And it goes through a lot of like the very basics in terms of breathing and stability to sort of work you up to whatever you want to be doing. I also like Restore Your Core a decent amount. That's Lauren O'Hayen's program. And then it depends on everybody's background. So Amy Baumgarten was on our call a few weeks ago, and she has a like breath and yoga based, it's just like, it's a little bit slower and a lot about like breathing and really connecting to your core. And I think that's a great beginning program, but it's not so much about strength training. One that's like really about strength training and more traditional fitness is Mutu System, MUTU. But Mutu System, I think that people would really benefit from having a PT one-on-one or doing something like Chelsea Method first before they went into Mutu. And I tend to agree with you. If somebody can do a personal program like with like one-on-one and get some visual feedback, that's maybe better than pre-recorded. Oh, and then Zoe Bowick-Levine also did one with us, and she has a program called Strong as a Mother. I'll put all of these in the follow-up email. There's a bunch.
Yeah, that's great.
Yeah.
Definitely.
Yeah. But okay. Strength training programs. And then let's see, you got a private question, but I can also read it.
I did, and they said it's fine to read it. So I'll read it. Background, grade 1 cystocele after birth. So if those of you who don't know what a cystocele is, it is a like a prolapse of the bladder. Grade 1, again, it's graded. Grade 1 is not super extreme. So grade 1 cystocele after birth, and it worked with pelvic floor PT to diminish it, returning to running slowly and gently with intervals. Sometimes it feels like you're going to poop involuntarily when out on the run. This never happens when I pooped at least once in 1 day. Sorry. Any thoughts on what's going on? So there could be a few different things going on. So those posterior pelvic floor muscles are what's controlling, the levator ani, that's what's controlling the rectum and the anal sphincter. It depends on if there was any fluctuation in the walls, if so the cystocele was coming down, if there was any like pressure posteriorly, if there was any increased tearing of the perineum during birth. The involuntary during running intervals could be related to the quickness of the pelvic floor to respond. So when that happens, like if we're thinking about speed of everything, that could be, if there's a cystocele, there's obviously like a little bit of a weakness potentially in the tissue in the pelvic floor. Might not be necessarily just specific to that closer to the urethra, closer to the bladder. It could be a little bit farther back as well. So if there's any sort of weakness there, if you want to make sure that you're also training it with speed. So making sure that if you're doing any sort of jumping, and I don't know if you have, doing any sort of just regular jumping training and like moving quickly like you would be doing in the interval, does that same similar situation happen? Or is it when you're fatigued or when anything else is going on into the system? The involuntarily could be also related to just like your nervous system getting used to the intervals, especially the fact that you said it doesn't happen if you've gone within the day. That just means that it's sitting in the rectal canal. But I would say like play around with testing things out of the interval, out of the running with speed and seeing how the pelvic floor responds. And if you've already had pelvic floor PT with the cystocele, I would, you've had that experience already, maybe follow back up with them since they know what's happening in the pelvic floor. They've worked with you. It's hard to say. Pelvic floor, I will say, is the one part of the body that you don't know what's going on with it until you test it out. It's very responsive. It can, especially when it comes to birth, it can respond either too tight or it's too, like, you know, it's not a one size fits all. And if you already have someone who has worked with you on it, I would say go back to them, and they might know a little bit more as to why it's happening. But it also could be related to how your run form is with the interval as well. I'm actually working with another patient right now who has fecal leakage with running, and it's mainly related to the fact that she stiffens up a lot when she runs, and that stiffness doesn't allow her to like accept load very well. And in the relationship to the pelvic floor, the posterior aspect's a little bit weaker, so she'll have some fecal seepage. So it might not necessarily be that like it's that weak. I would say it's probably going to be a better, like I said, if you have that experience with the PT, go back to them and be like, was I a little bit weaker? Was I really tight back there? And then you might have a better idea of what's happening during the running interval. That was a longer answer, but that makes sense.
Yeah, let's see. You can write in if you want to clarify.
Mm-hmm.
So we have some time for more questions. I'm gonna ask one that's personal to me, but I'm not a runner, I'll say that, and I sometimes dabble in running, which I think is not great for my body. Like I should commit either way, you know. But I'm curious to know your thoughts on footwear, and like how much that makes a difference, especially thinking about loads and postpartum. And if like, here's my very specific story, was that when I transitioned to like barefoot footwear a few years ago, and so don't have a lot of padding under my feet. And when I did run before I was pregnant, I got to a place where I was like totally fine.
With
And
barefoot footwear?
Yeah, with barefoot shoes. And then that's what I ran in postpartum, because that was like I like basically didn't have sneakers anymore. And it like, I feel like I compounded my injuries with not having any padding.
Yes. So the barefoot running in general, I think like you really need to like adapt into it, and like it is definitely not for everyone. Like you need a very specific type of foot, and you need a very specific type of run and control to be able to sustain that for a long period of time. When we think about postpartum, naturally the foot can actually tend to widen out a little bit, and because there's increased gravity, like everything's a little bit more elastic. So I know people that, you know, go up a half a size in their run shoe and stay there for prolonged periods of time. If we're talking about shoe wear during running, 1000% you have to have good impact, like shock absorption. So something that's like relative, you know, you don't have to go crazy with like a Hoka, which is like, you know, this thick, but you want to have decent shock absorption. And you also want to have something that's giving you, I'm a big fan of calcaneal stability. So your calcaneus is like the heel bone, and you'll notice with, you know, a lot of more, you know, structured running shoes, there's a dense heel cup. And I like that for my pregnant and probably honestly immediately postpartum runners, because you're looking for something that's going to give you a little bit of stability. Your system's a little bit less stable. Gravity is going to respond a little bit more on you. You want the shock absorption. You want the control. And like, you know, I'm not against, like, it depends on the foot, because your foot structure, and I think that's the big thing, is that your foot structure can change from pregnancy. Like you can go from having maybe a really high arch, stiffer foot to not. And that is going to impact that can totally change your shoe wear if you're used to running in one shoe versus another. So that can change. And I think like figuring out what you need would be helpful. But pregnancy and in that subsequent postpartum time, impact is really, really important, and absorbing that impact. Obviously form and like strength play a role in that. But I think if we're talking like just specifically from, you know, physiologic, what happens, like you want that stability, you want that shock absorption, so that there's not too much force going into the system.
Thank you. That's really cool. Yeah. Lisa's asking, is there anything in particular you like about Fit for Birth? Well, let me clarify too. Does Fit for Birth have programs for postpartum?
I just know that they do. They like, it's like a certification, so you'd have to like
find. Yeah, you want to find Fit for Birth fitness professionals. Yeah. So like Maddie Wasserman, who's the fit doula that we work with a lot, she is a Fit for Birth professional. Kalia, I can send some fit for birth professionals out too. I think they do have a really holistic training program. And I would add pronatal fitness to that list too. Folks who have trained with pronatal fitness have a really, really strong background. And pronatal has virtual personal training. So you like sign up and you get a personal trainer, and then you can move through, they create a program for you and you can move through like a set of videos and check in with your trainer every week. So that's a really nice option as well. Fit for Birth and Pronatal both train fitness professionals. They don't have their own classes.
Yes, that was my bad.
No, that's cool.
Yeah.
Yeah. Any other running questions? Okay, here's one that just came to me for another second. Do you know about anything in terms of like a gait change or there being a negative in terms of running with a jogging stroller versus just running?
Yes. So running with a jogging, so a big thing that like it comes up in pretty much all of my postpartum running patients is a lack of arm swing and trunk rotation. So, and that tends to happen because as we get pregnant, that intersternal angle, that rib angle gets a little bit wider, your rib cage externally rotates, and everything just becomes kind of like, you know, everything stays back here. Trunk rotation is extremely important, and arm swing is extremely important when it comes to the like pelvic floor, core, pistoning system loading onto one side. So knowing that, running with a running stroller, no matter, like a lot of the times people will like lock in and like just like go. So that can do two things. That can kind of lock in your chest and take out any rotation, which means rotation has to come from somewhere. So it's either going to come from your legs or your hips or your back or like wherever. And then you can also, thinking of things that I like, cues I tend to give my postpartum runners is like they tend to run like they're still pregnant, right? Like belly out, kind of butt back. You want to think, you know, Michael Jackson forward lean when you're running. But when you're pushing the stroller, that can become pretty apparent as well. So like hips are going to go back and your trunk's locked in. So then the legs are just kind of like doing their own thing. Obviously, you have to, if you have to run with a running stroller, you have to run with a running stroller, and that's the way it is. But a big thing that I would say is make sure you're pushing it far enough out where you can get your knees up, because a lot of the times when something's in front of us, we'll do a lot of this, but not a lot of this. And knee drive is extremely important with run form. So make sure you're pushing it far enough out where you can have a good knee drive. And then I would say a big part of it is try and swing, push it with one arm and swing the other, and then alternate. So that at least you're getting some sort of trunk motion, some sort of movement going on in the core, and so that there's not so much force going on through the pelvis. But that's a biggie, definitely.
I'm so excited I asked that question. I've like never thought about it before. Wow.
That happens a lot.
Totally.
I would say the same thing goes too for like walking with the stroller. I've had a lot of people just like come and like, you know, they come up with certain aches and pains after pushing the stroller, and it tends to be because, you know, it allows you to fall into this type of position where there's more pressure on the low back, more pressure on the abdomen, butt's not really doing a ton, your calves are doing a lot. And then also too, like normal walking, if this is like that normal pregnancy walk, you want to have that rotation, that arm swing, everything going. So the same, I would honestly give the same cues for walking as I would for running when it comes to like pushing a stroller.
Yeah, cool. Is walking and strength training a good combo to do before getting into running?
100%.
Yeah.
Yes, because you can train all those things that we talked about as far as like arm swing and getting your legs moving, and then build up strength in the same time. And like walking is still impact, you're still upright, you're still getting, you know, all of that going. So that is definitely a good way to get back into all of it, you know, without actually getting into running. How important is it to address diastasis recti postpartum in the efforts to get back into running? Yeah. So, it's always important to kind of know what's going on there. And I think I don't tend to measure the DR super quick postpartum, because no matter what, it's still going to be there. And sometimes like knowing that can be really just like, it just kind of like can mess with your head a little bit. And like, it's going to be there. The widening of that linea alba separation. So for those of you who don't know, diastasis recti is the separation in that midline at your linea alba of your right and your left ab walls. It has to happen during pregnancy. period. So naturally it will happen. When we run into issues is when it sticks around in the postpartum period, because then you're running into some stability stuff, and that can lead to other issues down the road. So when we're thinking about running, a big thing that is important is knowing that, thinking of that, like, first thing that I want you to get is your muscular control. So you want to have good muscular control, feeling that deep TA, feeling both right and left sides kind of come in right, like, before you get back into running. So kind of thinking of that step-by-step process is like making sure you have your abs and your pelvic floor, that they're with it and they're healed. That's part of that process of making sure that you don't feel like at one point either your abs totally shut off, or you feel like, if you're kind of like poking around, do you feel like a huge kind of gap or a huge, like, depth change? That's a bigger measurement that we actually care about, is that depth change. You want to make sure that that's all intact, because if you're going into something like running and there is a weakness in that system, your body will start to tell you that. And because there's so much force going on through like the rib cage and the pelvis, there's so much of this happening with every step. If there's a weakening in that pressure system or in that abdominal wall, that can lead to either maybe it getting worse or causing other issues like back pain or like down the chain, anything else going on. So it's definitely, you want to, I think, like diastasis recti, like, okay, but if you want to make sure your abs are stable, and like that's a big thing going forward. Can they manage pressure? Can they manage coming together? Are they healthy? Do you feel like you can get them working? And then you're going to be set up for success going forward. More questions.
Just somebody saying they worked with Postnatal already and can vouch for them being excellent. And then thanks for the tips about walking, running with a stroller. Anything to be mindful of while walking with a baby in a carrier?
Yes. So similar kind of situation. Babies usually tend to be here, and it's the body will always take the path least traveled. So it's a lot easier to kind of do this and hang on your joints, hang on like the front of your hips, put pressure on your back, and allow the baby to like lay on your chest, versus coming up this way. So, and I run into it as well with some people who the baby's tinier. You want to support the head, so that means less arm swing. But as the baby gets bigger and as like they have a little bit more control, same kind of guidelines go through into that, which means like make sure you're swinging your arms and make sure your body weight is forward. So in that case, like this tends to become it, not necessarily that total forward lean where you're putting pressure forward. It becomes more that lean back. So instead thinking like there's like I always think of like envision something pulling at your chest where you're stacked rib cage on top of hips, and then just swing your arms as much as possible. Obviously you have to like a wiggling baby going on. So, and it's heavy and that's a lot of weight. So you want to make sure that you're forward, but still creating as much of a normal walk as you can.
And then this, I think, is like an ideal question to end on, actually. When you say your pelvic floor is healed, does that mean no incontinence or just less?
So incontinence gets normalized a lot, and it doesn't have to be. So like I always like, I think, and there's no shaming, there's no nothing going on, but the pelvic floor, if it is working as it should, if it's healthy tissue and it's working as it should, you should not be having incontinence. So yeah, I guess in like cut and dry, no incontinence. But knowing to like, as you get back into all this, like, sometimes, and it happens all the time, people are like, oh yeah, I'm a runner and I had babies, now I pee. And I'm like, you don't have to, there is no reason that has to become a normal thing. And like, that doesn't even necessarily mean the pelvic floor isn't healed. It could be that there's just a coordination thing going on, or maybe it's a little bit weaker. Like that might not be a stage of healing. It could be that there's like maybe a pressure attenuation thing, issue going on that's leading to incontinence. So definitely no leaking, but just because you're having incontinence doesn't mean that the pelvic floor isn't healed. That means that there could be something else going on.
Yeah, thank you for saying that. I would just echo it that like really right, if it's not the pelvic floor, it might just be something, but it's always worth getting checked out because these are things that we have normalized and people think are they are common, but they are also treatable. And
Very
it's like
comfortable.
very worth it, I think, for people to put the time in if they can figure that out, and have the like, can figure out how to pay for it also, to heal. So
Yeah.
that's great. Can you just tell people how they can work with you? And I'll share it in the email too.
Yeah. So I'm currently, I am seeing people in person, both like in the city 2 days a week. I see people at a studio on 26th Street. And then I'm also doing virtual visits still to accommodate for people either not in the New York City area or, you know, maybe other things due to COVID. So I'm available. My email, I listed it above. I think Ashley will send it out, and then, we can always take it from there. I'm always here for questions too. If you guys just have like a quick question that I either comes in later that you think of or anything like that, I can definitely be a resource for you. And if I don't know it, I will find out as much as I can and get back to you.
Totally. Great. Okay, and if any for the pregnant folks on the call, if you haven't taken childbirth ed yet, come take childbirth ed with us. And if you want more of this body information as it relates to childbirth, I cover that in our push prep class. It's really about anatomy and physiology, as it relates to the pelvic floor and pushing. Yeah, we're like all around, and I'll follow up with everybody on email. And if you're watching the recording, then you can just be in touch with us separately too. Thank you, Alicia. This is really,
Yeah,
really, really awesome.
I'm really happy. I'm also like sweating, so sorry if I'm like a little sweaty. It's like very hot in New York.
Yeah, totally. It's all good. Okay, cool. Have a great day, everybody.
Hi guys, thank you.